I'm Tiff Bortwood. I'm the Managing Director of Australian Genomics. I'm very excited to be here today on Ngunnawal and Ngambri country to co-host the first roundtable policy meeting we have for cancers with Rare Cancers Australia, and Christine Coburn.
Thanks, Tiff. I'm Christine Coburn, CEO of Rare Cancers Australia. Equally delighted to be working with you, Tiff, and your team at Australian Genomics on this Genomic Policy Roundtable Series.
So you've heard that we're very excited to be bringing together stakeholders from across sort of the genomic and patient area and policy area to engage in these discussions today. We'd love to hear from you also. So if you're interested in contributing to these policy discussions, we'll have follow-up or additional roundtables in October and November. And there's also an email address that you can send your thoughts through to that is now on the screen. So please do contribute to the conversation. We want as many different perspectives as we can get.
And I'd also like to add my thanks to our sponsors of the Roundtable Series, MSD, AstraZeneca, Bayer, Roche, Pfizer and GSK, and of course the partnership with Australian Genomics. Thank you all so much for making this happen. What do you see as the benefits of organisations like ours working together for a piece like this?
Oh, look, I think collaboration such as this is critical to ensure that as we're having policy discussions and hopefully informing how policy shifts in healthcare delivery for people with rare and less common cancers, there is collaboration between sort of the clinical groups, the policy groups, and very importantly those with lived experience to keep the focus on the outcomes for patients.
I think that's a really important point, Tiff, and one of the things we've been really mindful, I think, in designing this series is that we're getting as many perspectives as we can. I think sometimes when we're conducting these conversations, we forget to include, well, not we, but people do forget to include the lived experience, and I think you really can't co-design things effectively without it. But we've also got fantastic perspectives from our Indigenous researchers and childhood cancers particularly. So I'm really excited about the multiple stakeholders that we've got involved.
And we've worked together for a long time. So we've been long-time collaborators, yes, Australian Genomics and Rare Cancers Australia. So it's lovely to, bring the band back together. Absolutely. For these policy roundtable meetings.
Absolutely. What do you hope that will result from these kind of initiatives, pulling all these stakeholders together and talking about the different nuances in genomics being implemented in healthcare in Australia? What do you hope we can achieve here? Look,
I really hope that with this multidisciplinary and sort of multiple stakeholder gathering, we can galvanise more attention and more focus on the need for comprehensive genomic profiling for patients, the more comprehensive genetic testing about adult risk for cancers, as well as sort of, as Ness Terrell will be speaking about, ensuring that children with cancers receive the best possible care they can. If we can get sort of alignment across the sector about the importance of these technologies in these applications, I think, the momentum that's been building, we can actually reach a crescendo and see some real change in how cancer care is delivered.
And it does feel like we're kind of at a point in time where real change and implementation is possible, doesn't it?
Oh, it absolutely does. And I think, it's sort of a pregnant moment with lots of examples internationally where this is being implemented into care for people with particularly rare and less common cancers. And it's transformative. These technologies are transformative to their care. And we can see that it's cost effective. We can see that it's clinically effective, and it can be implemented not only in countries like NHS England, Genomic Medicine Service, but our regional neighbours in Japan and South Korea.
Absolutely. I think working in the rare cancer space, we sometimes get quite bogged down, and quite rightly, with the challenges of the everyday people with rare cancers that just are not well suited in our current healthcare system. But looking overseas, you're a bit of an international guru on genomics. I think Australians like to think we've got a great healthcare system, and we're a developed country. We're wealthy. Where do we really sit in the global picture? And what are your hopes for moving us forward in this space based on kind of what else is going on out there?
Yeah, it's an interesting and somewhat challenging question. I think we have a healthcare system that does its best to deliver quality care at scale for Australians, but as is always the case, that will tend to hit people in the middle of the bell curve. It will not reach those with severe needs that have rare or less common disease. And this is where technologies like genomics can be so powerful, because instead of looking at these interventions as sort of one population, one intervention, one outcome, it's an intervention that can be applied to different patient groups and the population more broadly and get different outcomes. But I think the challenge we have is such a disruptive technology will require brave moves.
Yep.
And really changes across healthcare delivery to yield those benefits. And I think it's time.
Yeah, absolutely. Do you find the conversation or the elephant in the room is budget impact of these kind of cutting edge sciences becoming standard of care? And what say you, Tiff?
Look, I think it is budget impact. I think we can demonstrate cost effectiveness and clinical effectiveness, let alone, the quality of life impact to individuals and families. The challenge is that the upfront investment to really shift policy and practice in healthcare delivery will be significant. And so we need courage. We need to learn from international exemplars, and we need policymakers that are willing to make long-term decisions, irrespective of political cycles. And actually think about long-term redesign of healthcare delivery in Australia to be able to take advantage of these, cutting-edge technologies. And in fact, the sort of original policy documents from 50 years ago talk about the importance of the fundamental human right to benefit from science innovations. We have genomic technologies available, but they're not available to the people who need it most with rare and less common cancers.
Yeah, it's not futuristic technology, is it? It exists, and it's actually being used here and now.
It is.
Just not equitably, not fully implemented, and we're just not reaping those benefits yet.
Yeah. So Christine, I'm interested in your thoughts and perspectives about what this might mean for people with rare and less common cancers.
Great question. The genomic-led care in cancer for people with rare, less common, difficult to treat, complex cancers is really the only way that we can progress improving outcomes and experience. Having access to genomic information early and equitably is really the most obvious way that we can start to shift the inequitable outcomes that we're currently seeing. We can't understand rare cancers unless we're looking at things on a genomic level, and we're enhancing molecular testing and screening, targeted therapies, immunotherapies where appropriate. We can't keep going through old school systematic thick chemotherapies, overlooking entirely molecular information that could be done if the testing was done at the right time and equitably across everybody that could benefit. There's just a real fragmented approach to who is getting what. And I think that, globally implemented genomic-led cancer care for those with rare and less common and poor outcome cancers, let's not forget about cancers like pancreatic, which have recently been recategorised to common, but has dreadful outcomes. So genomic, to me, it looks like we're looking at things and there's a microscope right there and we're not using it. So we need to put clarity on these cancers, what's going on at a molecular level, implement it equitably, and we'll understand them and be able to advance the outcomes in a way that is it's currently available. This technology, we know it works. It's just not properly implemented yet. So really important conversation for our Illness Common Cancer community, and it's one that has brought great hope, but we really need action.
So what do you hope to gain out of this roundtable series?
I hope to, I really love the multi-stakeholder model where we're going to get a lot of really rich conversation. It may be, quite robust. I think there'll be tensions, which I think is a good thing. But I'm really looking forward to people learning from one another and to having an output that gives us robust, we can add to the evidence base when it comes to this genomic framework that's being built in Australia. I think the real magic is having as many perspectives as we possibly can. The idea is not to bring together people that all agree with one another, but people that can bring things that hadn't been considered or hadn't been considered fully yet. And I'm hoping that this will be quite unique in that way, and that we have output that's helpful for decision makers in helping to implement genomic care for those who need it in Australia. Thanks for partnering with Rare Cancers Australia. It's been
Thanks for having us.
We're kicking off later today.
Yeah.
So thanks very much for coming along on the journey and partnering together. We love working with you guys.
Always a pleasure, Christine.
Thanks, Tiff. Hi Ness, thanks for joining us for Rare Cancers Australia and Australian Genomics Roundtable Series. We're very pleased that you can help contribute some content. Can you introduce yourself and tell us a little bit about the work you do?
Yeah, thanks Christine. Really appreciate the opportunity to contribute to and participate in the roundtables. I'm Ness Tyrrell. I'm the Program Director for the Zero Childhood Cancer National Precision Medicine Program at Children's Cancer Institute.
That's brilliant. We're really pleased to have the input about the state of play for children and children research and genomics, so thank you very much. Ness, what have we learnt from the Zero Childhood Cancer program so far?
We've learned quite a lot in the last 7 to 10 years, and in fact we've just recently published in Nature Medicine in June this year the objective clinical benefits that we can see and the overall clinical benefits that we're seeing in children who have a 2-year progression-free survival. This is actually really critical because we're talking about children who have rare cancers that are aggressive, they've relapsed, or they're very hard to treat and incurable. And we've shown that there's a 55% objective clinical benefit of having a comprehensive genomic profiling performed on their tumours and also their germline. Really importantly, we're seeing a very high rate of germline predisposition in these children, and that's something that has implications not just for them but for their biological relatives as well. Absolutely. And so the outcomes are really promising, very compelling for us to keep going, which is why we have now expanded the program to be available not just to the high-risk kids but to all children in Australia with cancer.
That was a really exciting advancement, certainly. I'm just thinking, Ness, the work that you're doing at Zero is sort of in the research space. And in the Rare Cancer Moonshot that we launched earlier this year, we advocated for a timely transition of research into clinical practice, into standard of care. What does that look like for the childhood space? And are we likely to see this approach as standard of care no matter where you are for every child? What is the vision there?
Look, I think it's a really complex challenge that we have. We've come a long way with the high-risk children, and we've got a lot of real-world evidence to show that this is making a difference, and it is something that we should introduce and implement into the health system. The health system needs a lot of support to do that. This is a very specialised workforce where we've created new roles and new skill sets, and so the amount of support that we can provide and the resources that we can provide are really important to take that next step. I think it will take the next 4 to 5 years for the health system and for us as a program to be ready to implement some of this, but it's something that we can continue to do in that research translation and clinical research translation environment right now. to continue to learn, to continue to build the workforce and skill sets and the educational tools that are required to make this something that is more business as usual in a health system environment. And that means that the hospitals themselves and the clinicians and the health professionals in the hospitals themselves need to be literate in this, what is still a very new, discipline in terms of molecular oncology, genetic oncology in children's cancer. We are very fortunate that all children in Australia are treated in the public health system in one of 9 paediatric oncology centres around the country. And I think that concentration really makes it a lot easier for us and creates an environment for kids' cancer to be the pilot or the exemplar to be able to implement precision medicine over time.
Where does Australia sit in the childhood cancer research space, Ness? From my understanding, I think we're certainly in a leading position. But globally speaking, how different are approaches with genomic medicine for children, and what is Australia's role in that?
Yeah, so Zero has actually been leading the field and leading the world over the last few years. We initially looked to Europe and the US for where we should be going and made some very early decisions in terms of really expanding the comprehensive profiling that we do, and that's given us the leading edge. So now the world is looking at us saying, oh, we need to do that. Okay. So that's been fantastic. What I can say is that all the major countries around the world are still focusing on the high-risk, aggressive children's cancers. And what we've done towards the end of last year is we made Zero available to all children with cancer, irrespective of their type, stage or risk. And what that means is that we have a world first in Australia so that all children can access this precision medicine and this comprehensive genomic profiling. And we're really proud of that. Of course, the trick here is to make sure that we can keep doing this in the longer term and stay ahead of the curve by investing in research, because we are generating an enormous amount of data by being able to enrol all of these children. And so we can't forget that we need to keep moving to improve what we do.
Absolutely. We're feeding into the genomic framework that's being built out, the National Genomic Framework. What are the main things that you hope are fed into and prioritised for childhood cancers in a national framework? And what are the main policy areas that should be front of mind?
That is actually quite a hard question because everything feels important. Yes. But what I would say is I think the cancer predisposition, the germline cancer predisposition, is extremely important because we're seeing a much higher reportable rate in these children with cancer. And that means we must make sure that we are developing and establishing services in paediatric environments, so in an age-appropriate environment, to be able to bridge that gap between children and adults. I think it is also really critical that we don't build a wall, or we don't maintain the wall that's already there between the clinical environment and the research environment. Yes. We really need to break that down so that we are absolutely delivering research-driven clinical care, because if we don't do that, we will continue to be too slow in what we translate and how we translate it. I think they're two areas that I feel quite passionate about. And then, of course, one of the things we can't forget in a genomics framework is actually the final piece, which is accessing the treatments that are informed by the genomics. We've only done half our job if we say, well, we can treat, we could potentially treat with a targeted drug against this particular variant. But if we don't have the trials or the treatments available, then we actually haven't finished.
Yeah, absolutely. I think that translation piece, and I like that you just highlighted that genomics for children and everybody really is more than just the science. There's infrastructure, there's policy, there's workforce. It's a really complex area, and hopefully, certainly in the roundtables that we're going to have, the next 3 roundtables, we'll have some robust conversations and content around those considerations. But certainly we hope that it feeds into the genomics framework that is currently being worked on, so that all of these incredibly important points are raised and considered, and what we get is a really great fit for purpose framework.
I look forward to those conversations, because workforce is a major issue.
Huge.
And the environment in which the workforce is able to deliver precision medicine or genomic care is critical, because we know at the moment that the health system that has been built, which is one of the best health systems in the world, is not able to keep pace with genomics, because it simply moves so fast. And so working with the health system to change that over the next few years is going to be vital.
Absolutely. I think your vision, but also where you've already come, the work that's already been done in Zero is incredibly groundbreaking and provides a lot of hope for people. I'm personally very proud of the work that you've done on behalf of Australia, so I thank you very much for joining the Roundtable Series. Look forward to hearing your presentation this afternoon and to furthering our work on this genomics piece for Australia.
Thanks again for the opportunity, Christine.
Hi Louise, thanks for joining us for the Rare Cancers Australia and Australian Genomics Roundtable Series. We're very happy to have you. Can you just introduce yourself a little bit?
Thank you, Christine, and thank you for allowing me to join you today. My name is Louise Lyons, and I'm a proud Djarwa woman from Western Victoria. I'm also the Senior Manager of Strategy and Policy Indigenous Genomics at the Kids Institute, and I work with Professor Alex Brown.
It's really interesting and important work that you're doing, Louise, and it's a really important part of the Genomics Roundtable conversation when we're looking at genomics for better outcomes for people. In this genomic revolution that we're in at the moment, what are the sensitivities or nuances or important things that we're not necessarily capturing for Aboriginal and Torres Strait Islander people?
I think it's multifaceted, but I suspect that the rapid pace of genomics is leaving a lot of groups behind. I think there needs to be an opportunity for groups, particularly Aboriginal and Torres Strait Islander people, to understand what genomics and genomic medicine can do for them. And we need to be able to ensure that they not only participate but can lead in the genetic and genomic health space, so that they can truly receive the benefits that I think precision medicine in particular has to offer Aboriginal people.
Absolutely. I think the work that you're doing is incredibly important, and I think to give that work a platform and to make sure that it's in the work, in the conversations and in projects like this, that it's a major part of the consideration, so that things are not misdesigned or are inappropriately designed to be suitable for everybody and outcomes. So what are some of the barriers that you've seen for Aboriginal and Torres Strait Islander when it comes to accessing genomics, precision medicine, clinical trials? What are you seeing? What are you learning?
I think if we take genomics out of the equation, there are historical reasons why Aboriginal and Torres Strait Islander people sometimes feel they can't access our health services, our mainstream health services. It's got a lot to do with the past and contemporary issues, such as experiences of racism in some of our health services. Where people are located often means that they have to leave rural and remote areas to travel to a health service or a specialist service. There are fears, I think, for what might happen to people when they enter into this space. There's still a lot of misunderstanding around genetic and genomic testing, what that might mean for them. There are fears, for instance, that their DNA could be misused by law enforcement. Yes. We've seen cases like that happen. In Victoria, where I'm from, there is still an association with genetics and eugenics, yes, and poor research of the past and to a certain extent today. So I think what we need to do collectively, and it's certainly what the Australian Alliance for Indigenous Genomics is trying to address, is understanding what those fears are, looking at what communities' priorities are around their health, and then looking for ways in which genomics, in particular precision medicine, can do to deliver those benefits back to Aboriginal people. It's a long and slow journey, but I think an incredibly important one, that we bring people into our space and to work with us, and really allow Aboriginal people to lead.
Yeah, right.
This is a leadership issue.
And so what do we need to have front of mind as we come together and have these conversations in roundtable format, for example, and feeding into policy work? What are the things that we need to have front of mind for leadership and participation from First Nations people?
I think working with groups like Align is very important. We've built very strong infrastructure, including Australia's largest and probably internationally the largest Indigenous Governance Committee and Council. The committees sit within 6 jurisdictions and growing in membership, and we utilise these Indigenous governance committees and the council to guide our work and to prioritise for us what is important for Aboriginal people. They're a representative group of Aboriginal and Torres Strait Islander people that have come together through our invitation to work with us and to ensure that cultural integrity is built within our work. And I think those sorts of structures are really important to guide other groups around the work that they undertake, be it research or developing health services, and truly understanding what community are asking for and what they need. And of course, once again, ensuring that we place Indigenous governance at the top.
Absolutely. I think we can learn a lot from listening to those pieces that are just so critically important to moving forward, and equity of everybody benefiting from science and great healthcare services. What does the opportunity for this roundtable and for you to feed in this important work, what do you hope the outcomes of participation in this multi-stakeholder piece, what can we all achieve together? What are you hopeful for?
I think without allies we can't achieve our vision. So we're very excited to join Rare Cancers and the group that you're putting together to look at extending our networks and to ensure that we can amplify our voice through our allyship. We're a very small group and we really do need support from others like yourselves, from government, from the major health services, from the primary healthcare services, from clinicians and researchers. The Align network is large, but we need it to grow. And we see these opportunities as being able to develop our own policy in harmony with the policies that this group will come together to do, and to send a very strong message, I think, to government around the need to include underserviced groups in this narrative.
I think that your presentation at the round table later today is a really a highlight. I'm looking forward to listening and learning, and I think again thank you so much for joining this Rare Cancers Australia and Australian Genomics piece. Very happy to be working with you, Louise.
Thank you, Christine.